Look, getting anything done in your practice starts with your mindset. You gotta change your mind first. Firm non-negotiable decision with yourself. Second, you have to make a firm non-negotiable commitment. Third, you gotta get the right people around you.
My goal is to help dentists to get their practice to work for them rather than them working for their practice. A dental office really has to be organized. If it's not organized, it's inefficient and underproductive, because without that organization in place, it makes it much more difficult to conquer dental problems for our patients. They don't just happen, you have to make them happen. And the way you make them happen is by improving your communication. And when a dentist starts to communicate more with the people around them, including their patients and their staff, things in their practice just go better. I think the big lie out there in dentistry is that as a dentist, you have to be the patient's friend. As dentists, we have big hearts and we want to help people. But the truth is you're not there to be their friend. You're there to be their dentist and to get them better and to fix their dental problems. So when we get confused and we're sitting in front of the patient and we're thinking that we're there to be their friend, what we're actually doing is working against our profession, because we start breaking down treatment plans or cutting costs or taking shortcuts, and in the end, who loses is the patient.
This is the biggest thing that I want you to understand. There's a big difference between strong interest and enthusiasm. Enthusiasm doesn't always mean that you're being a cheerleader, but someone who's truly enthusiastic, they decide, they move, they go, they get it. We want to take it a step further. We don't want people just calling in, we want them calling in and getting on the schedule.
When you think about it, we have patients laying upside down in a submissive position, and the ability to communicate with that patient is really what's going to win the patient over. It's not your crown prep, it's not your filling, it's not what dental impression material you're using. What really wins the patient over is stellar communication. But as a dentist, what we do is we save lives. People with teeth live longer than people without teeth, and people with more teeth are more confident than people with less teeth. So we're saving lives, we're increasing longevity, we're improving people's quality of lives.
I'm going to help this person. No matter what it takes, this person's going to get better. There is nothing that's going to stop me.
And I think dentists tend to forget about that because we're bogged down with insurances and staff and office overhead, and there's so much that's involved that I think we lose sight of the reason why we do what we do in the first place. Improving the dentist lifestyle is all about giving the dentist the freedom that they desire to spend more time with their friends, their family, go on vacation, be able to be away from the office without the office completely collapsing. So the idea behind the lifestyle dentist is that you can own a practice, you can have a practice work for you rather than you working for it. A practice that actually runs itself with a great team, patients who say yes, a full productive schedule with income coming in, and the ability to market and attract more quality new patients to your practice.
So congratulations to you. You're doing something the dental school should be doing. But so am I. So should the ADA be doing these products.
She's an amazing speaker, a super communicator. She's funny, she's witty. She doesn't let you go until you learn something. So that's amazing.
She's very entertaining. She shows you how to do things, and it's very easy to follow and understand.
I love what I do because I see the change that it makes in dentists' lives.